We're here at the RSNA conference in Chicago, Illinois, demonstrating our services at Expert Radiology. We specialize in primarily brain, spine, and musculoskeletal imaging. I saw a need that patients needed to understand their reports better. I'd have friends that would call, friends' wives that would call and say, what does this mean in English? Patients, by law, they have to have access to the records, but that's only half the battle, right? They also have to understand those records. So we take a radiology report, either our own, very detailed, or an outside report, and we add certain features. We colorize pathology such as herniations, we colorize the curvature, we compare it to a normal healthy spine. Then we do custom illustrations, just like you would find in an anatomy textbook, except they're custom to that individual patient. We do that in the sagittal plane, we also do that in the axial plane, depicting approximately the size and level of herniations, bulges, osteophytes, all the different pathology that one can see in the different curvature. And then the last thing we do is basically a simplified patient explanation. It breaks down the radiology report and simplifies it so that a layperson can understand. We had a headshot of the reading radiologist. This gives a nice little touch in terms of this is a real human, this is a real radiologist, neuro or musculoskeletal fellowship trained radiologist who's reading the report. It's not AI. So instead of getting like a 1 or 2 page report, they get like a 10-page report, and patients can understand that. And patients like it, ordering doctors like it, neurologists, physical therapists, orthopedic surgeons, pain management doctors, primary care doctors, even chiropractors, all the way to spine surgeons like our reports, because it can save them time in explaining to patients why they're recommending a procedure, for example, or conservative care or physical therapy, because it saves them a little bit of time and maybe improve their compliance rate a little bit, and also improve patient satisfaction, so that when the patient gets, a bill for hundreds of dollars or thousands of dollars, they understand that they got a high quality report. So it improves patient care and understanding of that care. I want patients to understand their radiology reports, to relieve worry where there shouldn't be worry, and to make sure that the patient gets treated appropriately when there is a cause for concern.